Cholangiocarcinomas can present in different areas with different symptoms. They may mimic pancreatic cancers, presenting in the lower end of the bile duct with symptoms and signs that are similar to pancreatic cancer and have to be differentiated from pancreatic cancer because the treatment options are different. The majority of bile duct cancers present just as the bile duct is arising from the liver, and these are called hilar cholangiocarcinomas. This is a very common site, and it's a complex site because that's exactly where the major blood vessels are going in and out of the liver, and that dictates what is possible to do from the point of view of surgical treatment. The bile duct cancers, cholangiocarcinomas, can also present in the periphery, the outskirts of the liver, where liver resection is usually possible, although in some cases we may have to consider combining surgery with preoperative chemotherapy to shrink down the tumours and ensure that they be completely removed. For the majority of patients, we don't establish the cause of cholangiocarcinoma. Certainly for patients in the UK, the majority of them have no background disease or disorder of the liver. They've developed it spontaneously, as is the case for most other cancers. So usually we don't establish a cause. There are some conditions which can predispose and increase your risk of developing cholangiocarcinoma. In the UK, the commonest one is a condition called PSC, or primary sclerosing cholangitis, which is a chronic condition causing inflammation and scarring of the bile ducts, and that significantly increases your risk of developing cholangiocarcinoma. It can be particularly difficult because in patients with both conditions, PSC and cholangiocarcinoma, the options for treatment might be more limited because of their background chronic liver disease. So the cancers are mainly glandular cancers. They're adenocarcinomas. You can get variants, and sometimes we get different types of cancers that are represented within the same cancer nodule, but they're usually glandular cancers and develop within the glands within the bile duct. So they're cholangiocarcinomas are bile duct cancers that are arising within the lining of the bile duct. There's not really a difference. The majority of cholangiocarcinomas, as I say, are adenocarcinomas. Some of them can have they can be partly represented with other forms of cancer. So sometimes you get mixed cancers, and those are quite unusual, but they're usually managed in a similar way to cholangiocarcinomas. Yes, cholangiocarcinoma can be cured. It can be a complex disease to cure. That's not because the options for treatment are particularly difficult. It's just that the cancer often develops at quite complex sites within the liver, particularly around about the major blood vessels which are passing through the liver. And if the cancer blocks or invades or surrounds these major blood vessels, then the best option, which is surgery to resect the cancer, may not be possible. So for people who have got cancers that can be removed, surgery is the best option, but it depends on the extent of the cancer and particularly whether or not it's involved any of the major blood vessels to the cancer. So the best form of treatment, if it's possible, is to have a surgical resection where usually a portion of the liver is removed, and that certainly is by far, in a way, associated with the best chance of cure. So surgery is the first line treatment, assuming that the cancer hasn't spread elsewhere. If the cancer has spread to other parts of the body, then the first line treatment would be some form of chemotherapy. If the cancer is within the liver and can't be removed for any reason by surgery, then there are several other forms of treatment. There has been some data for peripheral lesions, that's ones on the outside portions of the liver being treated by thermal ablation. You can consider giving radiation treatment, radiotherapy, and particularly focal radiation treatment such as CyberKnife or Sabre to lesions that can't be removed, but it's not associated with the chance of cure that is associated with surgery. There is also an interest and some early evidence that transplantation may be appropriate for some patients with cholangiocarcinoma. Currently in the UK, liver transplantation is not offered for patients with cholangiocarcinoma, and it's not offered in most other countries, but there are some early trials that suggest that for very carefully selected patients it may be beneficial, and certainly in the UK there are proposals to consider transplantation for very selected patients with both cancer and a background of liver cirrhosis.